Why passive euthanasia is unethical. Recently in class, we discussed the topic of euthanasia and the professor introduced us to Jacques Kevorkian, who is the founder of the machine that provides the means for physician-assisted suicide. There are three types of euthanasia. The mentioned one, where the physician provides the terminally ill patient with the means to commit suicide, like a rope or a button that they can push, and three lethal chemicals would be injected into their system. But this means that they're practically killing themselves. The second one being passive euthanasia, where, coming from the name, the physician plays a passive role by withholding treatment and interrupting treatment. And active euthanasia is where the physician plays an active role by injecting the patient with potassium chloride. While I was trying to find pro-arguments that are in defense of passive euthanasia, I came across Philippa Foot, and she analyzes euthanasia using two moral principles: justice, which is the right to life and rights in general, like don't kill and don't interfere, and charity, which is promoting someone's good and trying to reduce suffering. For Foot, the big answer is whether euthanasia depends on rights plus intentions, not just whether it's more humane. Foot argues that active killing is more of a violation of the patient's treatment right, which is a matter of justice, while letting someone die is an act of charity because you're promoting someone's good. But this, in my opinion, is a moral problem. Her position intrigued me because she admits that even when someone gives permission for something to be done, the moral issue is not entirely resolved. It does not follow that there is no moral objection just because consent exists. However, she does acknowledge that there may come a point at which a doctor's assistance in prolonging a patient's life does not actually confer any benefit, and in such cases it is not contrary either to justice or charity for treatment to be stopped. But in my opinion, her argument for withholding treatment would be permissible when it no longer benefits the patient has a major flaw that my main point revolves around. If charity demands we act in the patient's best interest and promote their good, and justice is the right to life and to trust your treatment won't be interfered, both active and passive euthanasia are morally wrong. If taking Foot's logic, we should be against both, only supporting it where there is an act of reducing suffering, choosing one of the both, passive or active. Passive euthanasia actually intensifies and prolongs the death of a terminally ill patient, unlike active euthanasia, because it's done swift and precise. I argue that her argument is flawed and inconsistent, and if we are to determine death is the best option, it should be done by active euthanasia. Singers has close beliefs to James Rachel's, which we discussed in class, that he talks about in his book Practical Ethics, wrote in 1979, where he devotes half of the chapter, which is called Why Killing is Bad, on the case of euthanasia. Singer makes a purely consequential moral case against passive euthanasia on the grounds of what produces the least suffering and the most consistent moral reasoning. Singer bases his point on preference utilitarianism, where an action is morally right if it best satisfies the preferences of all those affected. With this in mind, he turns to passive euthanasia and asks a blunt question. If we have already decided that the patient's death is the morally preferable option, why would we choose the method where death is slower and more painful? Singer argues that we do not justify a moral difference between acts and omissions in an ethic based on consequences, since often an act and omission have the same consequence. In many cases, the consequences of painlessly killing are in fact better than the consequences of simply allowing someone to die. The core of his objection to passive euthanasia is that it does not hold a moral superior position. It just disguises itself in the same intentions behind inaction, while the patient pays the price. Singer also rejects the idea that passive euthanasia respects authority any better than active does. Is it reasonable to hope that the doctor who gives a lethal injection is a murderer who deserves to go to jail, whereas the doctor who decided not to administer treatment is practicing good and compassionate medicine? Logically, the answer is no. The intentions are the same, the desired outcome is the same, the only difference is the method. And the method alone, Singer argues, is morally irrelevant when consequences are identical. In my opinion, letting patients die is often crueler than a humane form of active euthanasia. Think about what passive euthanasia actually looks like. It can mean withholding nutrition, withholding a ventilator, and allowing a patient to die over hours or days from dehydration, oxygen deprivation, or even secondary blood infections. If death is deemed morally desirable, then why not simply provide death actively rather than passively? There is no moral credit in choosing the more painful path just because your hands are technically clean. In summary, I think that passive euthanasia fails in its own moral terms. It does not reduce suffering, which is the core idea to why euthanasia is practiced in the first place. It actually prolongs it. It does not avoid the moral weight of causing death, it just obscures it. If we are serious about ethics, we cannot allow the manner of dying to be directed by our discomfort with directness. If we're serious about ethics, we cannot allow the manner of dying to be determined. If we are serious about ethics, we cannot allow the manner of dying to be determined by our discomfort with directness at the expense of the patient who actually is dying. Here is the bibliography. The first link is to Philippa's foot essay, and the second one is to the chapter. It's the third chapter of the whole book that's on an e-copy of Peter Singer's. Thank you for your attention.